As orthopedic surgeons, Dr. Vaziri and I take care of a multitude of different conditions, but one of the main ones we take care of are broken bones, what are also known as fractures. Pretty much any bone in the body can have a fracture. There are bones in the body that we don't take care of. As orthopedic surgeons, we don't take care of skull fractures, jaw fractures, rib fractures, but pretty much any other type of fracture we will take care of. And fractures can occur from newborn to old age, and we take care of all patients in all age ranges.
Fractures can be described as being closed or open. Closed meaning the bone doesn't penetrate through the skin. An open fracture is also referred to in layman's terms as a compound fractures, and we grade open fractures based on how open the wound is and whether it's contaminated. For instance, a bad motorcycle wreck where you have the shin bone sticking out of the leg, that's probably the worst case scenario would be what we call a grade 3 open fracture. So there are various types of open fractures that we treat, but most of the time they are closed fractures. We do see a lot of fractures from sports injuries. Some of the most common sports fractures would be ones involving the collarbone, the top part of the humerus, the arm bone, ankle fractures, and wrist fractures. So certain sports are more prone to those injuries, such as with contact sports such as football, ice hockey, soccer, and some lesser contact sports. Obviously, you shouldn't have much contact in basketball, but you do see broken ankles in basketball and a lot of wrist injuries. So in addition to sports injuries, we do see a lot of fractures from trauma here at Hocking Valley Community Hospital. Those type of fractures we would see in motor vehicle accidents, of 4x4 accidents, ATV accidents, trail bike accidents most commonly. And so those fractures are what we call more high energy. These fractures involve incidents where the vehicle is going at a higher speed. So of course the fractures that we'd see would be more complex, and typically they would involve fractures again of the ankle, wrist, but also the tibia, the femur, and as well as the humerus and forearm. So those take more expertise to take care of and longer recovery times.
We also tend to see lower energy injuries, especially in our elderly patients. They may have osteopenia, which means just weaker bone, or osteoporosis, which is really weakened bone. Osteoporosis is common as we get older, especially in older white, lightweight females, but it can also occur in men. Again, those injuries are lower energy traumas. Commonly with those we are seeing fractures of the hip, we're seeing fractures of the shoulder, and fractures of the wrist. Treatment for our injuries can range from anything from a sling to a splint or brace to casting to needing surgery, depending upon what bone is broken and to what degree it is moved out of normal position, which we call displacement.
Obviously, most fractures can be diagnosed by x-ray. Sometimes, if the fracture is not readily visible on a normal x-ray, we have to get a CT or MRI. For instance, some of the athletes or runners or football players, even our soccer players, will have foot pain, and on x-ray we don't see a fracture, but if we get an MRI we can see the beginnings of a stress fracture. Most of the fractures we see can be treated non-operatively, meaning we either would limit the patient's activity, typically with or without immobilization. If a patient does need surgery, the three main methods we fix a broken bone would be internal fixation, which means the use of plates and screws. Second one would be use of a rod, like in a long bone, like in the thigh bone or shin bone. And the third way we use less commonly is called external fixation, where we bridge the break with a rod and pins above and below the fracture.
Duration of treatment depends on a number of factors. Children do tend to heal faster than adults, so their treatment tends to be shorter than the average adult treatment. Treatment also depends upon the bone that is broken. Some bones are very vascular and tend to heal very quickly, and others are not as vascular and have blood supply issues, and they take longer. Each fracture has its own, what I call personality, which we decide how long to treat with what type of treatment.
Here at Hocking Valley Community Hospital, we can treat most of the fractures that require surgery or non-surgical treatment. We have patients involved in a motor vehicle accident in which they have broken many bones, what we call multiple fractures. Those probably are best treated at a trauma center, for which we have a direct connection with Ohio State and Grant Hospital.
We take care of fractures every day here in the office. A lot of people come through the emergency room and get referred to us through the emergency room. Some patients will come through their primary care doctor's office, but also there are individuals that sustain injuries. They're concerned that they may have a fracture, and they can call our office and we can evaluate them.